The AMSA nerve block. When, why, and how do I give it painlessly? Whenever I'm working in the anterior maxilla on multiple teeth and big picture aesthetics are a concern. So sometimes a veneer case, sometimes a crown case, and sometimes, like in this example, a combination case. Why? Because it makes two people really happy. First and foremost, my patients, right? They get profound anesthesia for up to 2.5 hours, if we use the right anesthetic, that is. And equally importantly, they get to walk out the door as if nothing happened. They have full function over their face, so they can go back to work and take calls, audio or video. They can go grab lunch. They can do whatever they need to do to go about their day as if they never came to see me. Second person it makes really happy? Me. I get to critically assess global aesthetics. Like incisal edge position, I get to look at midline. I get to assess axial inclination. Things I need to do whether I'm direct bonding, placing veneers, crowns, or any kind of combination case. How? 3 steps, gang. Step number 1, define your anatomy. Now the good news is for the AMSA, it's tough to miss. But let's look intraorally as well. Landmarks, 2 big components to landmarks. We want to make sure that we're halfway between that mid-palatine suture and the gingival cuff. The other step to this is we want to bisect the contralateral premolars for our approach. We add those 2 together and we are in the exact spot we need to be. Step number 2, prepare the tissue. I like drying mine off with the gauze. It's fast, it's simple, it's effective, and when I do that before applying my topical anesthesia, I know I've got a great clean surface to work with. If you're looking for a crazy strong topical, Diclo Pro is amazing. It's by Septodont. I love it for palatals. I love it for PDLs. I love it for the AMSA. I love it for lots of other stuff, non-injection related as well. Step 3, deliver your anesthetic. Now, I want you to think slowly, a drop at a time. Some of you thinking, a drop at a time, I can do that, but can you? Because a drop at a time means you're delivering 2.2 mLs a carpule over 2 minutes. If you can, go for it. If you can't, if you're like me, cheat. I like the Dentapen. It's an amazing electronically delivered anesthetic system that does that job for us. So guys, AMSA, too many dentists out there avoid it because they think it's painful. It doesn't have to be. I want you to think when to use it, why to use it, and then the 3 steps for how to do it painlessly. I hope that helps.